Today's presentation is titled Shepherd Village Senior Flicks, Enhancing Person-Directed and Inclusive Care. It is my pleasure to introduce to you to Jessica Kaetsky, Senior Assistant Director of Care, Shepherd's Village. Jessica is the Senior Assistant Director of Care at Shepherd's Village Long-Term Care Home, part of the largest care in Central East Toronto, serving over 1,000 seniors. With more than 15 years of nursing experience, 11 in acute care, and 4 years in long-term care, Jessica brings a strong leadership and clinical background to her role. She holds a master's degree in nursing and is dedicated to advancing clinical practice, staff education, and the implementation of evidence-based guidelines. Jessica has led quality improvement initiatives aimed at enhancing resident outcomes and team collaboration. She works closely with her team and community partners to ensure care remains person-centered, responsive, and evidence-informed. Her passion lies in fostering a supportive environment for residents, staff, and families, and in driving meaningful change within the long-term care sector. Jessica, it's our pleasure to have you here this afternoon with us, and I'm going to hand it over to you. Thank you.
Thank you, Julian. Good afternoon, everyone. I'm truly honored to be here with you today. A heartfelt thank you to the RNAO for inviting Shepherd Village to share our journey with Senior Flicks. This project is close to our hearts. It is about listening deeply, honoring legacy, and transforming care through the power of storytelling. I'm excited to show you how something as human as a story can become a powerful tool for person-directed and inclusive care. Video, please. Would someone play the video?
Yeah, Jessica, just if you can just take your hand off the mouse, I just can't do it with you.
You know.
Yes.
But there, if you wanted to stop, you had to say something like, para, stop.
Yes, yeah.
But when I said that, it sounded, I didn't say it right.
Okay.
And everybody would turn around and look at me. I would then go home and I would tell about my difficulties.
Yeah.
And then my father would actually say, okay, because the distance is not that far, so you take a taxi.
Yeah.
But that didn't solve anything, because when I tried to explain the taxi, where to turn or what to what, the driver would actually say, aren't you Filipino?
Okay.
Why are you talking to me in?
Yeah.
So you know that difficulty.
Yeah, so that transition from China to the Philippines was not easy.
Not easy.
Not easy.
Although shortly then after that, being grown, and then later on, exploring the professional, the employment opportunities, then things, of course, you got a little smarter.
Yeah.
I like to think. And
very good.
And then you got to learn.
Yeah.
And actually, that's when I saw in the Philippines, there was an ad that said, okay, this station, the newspaper, the Manila Times, is now having a new station called DZWS, the women's station. Can you? The women's
in
station.
Manila, in
Yeah,
the
in Manila.
Philippines? Yeah,
So when I heard that, I said, wow, this is so different,
yeah,
you know.
yeah,
And so then I thought I would apply,
yeah,
and I did get accepted,
yeah,
although I applied only part-time,
yeah,
because at that time I was working for Ford, not the Ford Motor Company, but there were, see, this is the practice of businesses. Many businesses would have an office in Manila who would, with maybe a few executives who would supervise the company there, as well as other companies in the Far East,
okay,
you know.
yeah,
And so I was working for that, for the Ford executives.
yeah,
And so after work, I would go to the station
yeah,
and work from 6 o'clock. And that was interesting
yeah,
because I had programs like cocktail hour,
yeah,
starting from 6,
yeah,
the cocktail hour,
yeah,
two of a kind. And I had French, called Paris After Dark. Paris After
really,
Dark.
yeah,
And then, of
interesting.
course, concert.
So you see, Senior Flix is a storytelling platform hosted on YouTube, created by our spiritual life department, and it was funded, I think some of the funding came from the ministry. It really gives our resident the opportunity to share their life stories, which then our nursing team saw as an opportunity to support resident-directed care. So that's what Senior Flix is about. So why does it matter? Why does this really matter? As you saw in the small clip that started us off, these stories are fun. Some of them are sad. There is some history, but we learn from them. At the village, we found that through storytelling, residents reclaim their voice. The nursing team at Shepherd Village, with implementation of the RNAO best practice guidelines through the clinical pathways, but also through the BPSO, we are also a BPSO designate, identified that with Senior Flix as can be grounded into BPGs, like bringing principles of inclusion, equity, palliative care into practice. The team identified an opportunity to enhance and reinforce that person-centered philosophy towards a more culturally responsive approach that ensured care reflects the residents' experiences and values. Let us explore how. Oh, I went too fast. Okay. So the knowledge to action model. So we bridge the gap between using the knowledge to action model, we bridge the gap between research and practice. We leverage the Senior Flix by creating a space and time for our staff to watch the flicks. Sometimes with the resident, we had questionnaires to help evoke conversation around care delivery. Before watching the flick, we would ask specific questions, and we explored with our staff questions around what they see they can change with regards to the care of the resident, what emotions they felt after they watched or during the flick. Sometimes we had to stop the flicks just to understand better or explore a certain clip. The conversations were centered around care planning opportunities and perceptions, mainly perceptions of our staff before they watched the clip versus after. Later, we went back to interview the resident. We wanted to see whether there was any change in the way our staff are interacting with our resident. We found that listening actually and watching together makes it tangible and meaningful, helping our teams implement those best practices through the residents' lived experiences. And the impact is quite remarkable. I'm going to share with you a video here.
Aki, your story has touched so many people's lives here at Shepherd Village. How has storytelling impacted your quality of life?
Well, I find that the staff have listened to what I'm saying because I get more care. They hear me, they help me put on my makeup, my hair, my nails, rub this one here. She doesn't want to show her face. But a lot of it has kept me going. Now, now that I can't, I was recently in a hospital and found out that I am legally blind, and so the staff helps me more.
Thank you. Thank you so much. We're learning.
So the impact is far-reaching, and we find that basically for our staff, there is more empathy. We are in a healthcare kind of crisis with regards to staffing, and we find that sharing these stories, especially around our huddles, it's hard, especially when people are not accustomed to working in long-term care. We use these videos in so many different ways that I'm going to share with you. Residents feel seen, and I don't know if you could be able to hear it, but most of our interviews and questionnaires showed this. Feel seen and valued, and families feel more connected. Like some of them said to me, "Oh, I heard something new that I didn't know about my parent or my aunt," right? Staff really developed new skills, and it was an opportunity really for Shepherd Village. So I'll keep going.
Aki, your
Okay. So we are integrating storytelling by continuously creating opportunities to share stories during our BPSO meetings. Our BPSO champions are equipped with tangible tools to support their peers and model person-directed care. This includes using resident stories in huddles, in care planning, staff education, and overall engagement. Residents reclaim their voice. Our staff build deeper emotional bonds, and even families, like I said, reported a better understanding of their loved ones. These narratives and stories reinforce really the dignity and autonomy and really that individuality of the person, which is a core value for person-directed care. Some stories helped our staff understand some personal expressions better. Sometimes we have residents with responsive behaviors, and they remember something from their stories, because some of the stories are not the resident saying the story. It's a family member reading the story of what they remember of their family member. And so from this, you will see that. And also our activation, they'll look at the story as we watch and say, let's look at an interactive game that we can create for this, make it more personalized, right? So I'll share with you some of our results from the questionnaire. I'm trying to advance. Oh, sorry. Oh, this is feedback from our staff.
Arnie, thank you so much for coming to this. We just had one question for you. How has hearing resident stories impacted the way you give care?
I want to create an individual care plan for the residents, and by doing that, we do a life history, and the residents get to know the person, stuff they enjoy doing, and get to know them more, and benefits from listening to the residents from their perspective, stuff that they enjoy in their past life history, and I just enjoy and love listening to our residents.
Arnie,
Okay.
thank you so much.
Sorry. Technology. So what we see that was, oh, did I do something here? Sorry about that. Oh. I think. So one of the statistics that we had was we saw 85% improvement in our nursing and PSW social engagement. This statistic really highlighted how our senior flicks enhance connection and joy among residents. From a micro level of resident emotional fulfillment to a macro level of community inclusivity, Senior Flicks delivered a transformative experience, and it is a win-win, emotionally enriching and strategically sound for us at Shepherd Village. What was apparent to us was seeing the involvement of our staff, the way they spoke about understanding the resident better. So I'm trying to advance this. So here's our BPSO team. We want to thank you. Senior Flicks was more than a project for Shepherd Village. It's a movement, just like the RNAO, towards humanizing, dignifying care. Watch the stories, share them with your teams, use them to shape care practices. Let's keep evolving together, one story at a time. So.
Wow. Jessica, that was amazing. Thank you so much. And thank you to the staff member that that presented in the video, as well as the residents. Those videos were very impactful and really gave us, a taste to what those stories are about and how meaningful they are. The voice and the connections you are providing to your residents and staff through the impactful storytelling is really something. At this time, we're going to take some questions from the audience, and I do already have some in the chat here, Jessica. So the first question is: are the stories mostly delivered oral or in written? So is there anybody who's writing their stories down, or are they always being filmed and then recording verbally?
So in the beginning, the stories were recorded. So it is Senior Flicks. It's a YouTube channel. And so in the beginning, it was those videos and residents did write their stories through the spiritual life guidance, right? The partner guiding them, and family engagement, of course. And then eventually, because the funding ended, we saw how impactful it was. And so most of the time now it's through narrative. We don't film yet because you need different kind of infrastructure to do that. But it's lots of interest for our residents and seniors in the community.
Very, very nice. It's great. And next, I have a comment and a question. The comment is, what a great initiative. Thank you for sharing. And the question is there an opportunity for non-English speaking residents to share their story?
Yes, absolutely. Because we also recognize the area that we live in. We are in. Our home is located in Toronto Central East, which is very multicultural. So we have our Chinese-speaking residents. We have residents that yeah. So that yes, we do try to tailor it to meet the residents' needs.
Very nice. Very nice. And I see here a couple of more questions. Can you think of a residence whose story, if shared, could inspire or improve how care is delivered in your setting?
Is that for me or for the?
Oh, well, we can open it up to everybody. Um, that's fine. Um, asking the question then to everybody, and Jessica, you've
Yeah.
demonstrated on how this has improved the care within in the setting, and if anybody wants to comment on if they feel that this would work well in their organization, in their home. Can you think of a residence whose story, if shared, could inspire or improve how care is delivered in your setting? It's a great question, right? Uh, we know that our residents have great stories, and I know I was taken from there the first story that you had shared. I was engaged in how she had a history of then working in the evening and doing all those different things than her daytime job. That was very enlightening.
Yeah, and people can also look at the it's a channel. So Jackie's story is there. I know Carlotta, who was the presenter, basically the one whose flick we were showing a little snippet. She's on there, and her story is quite remarkable. So she was gonna be here with us, but things happen, and she does send her best. So if you wanna watch, please go to Senior Flicks. It's on YouTube.
Okay, that's wonderful. And another question here, is there a role for volunteers? So Kathy is asking a great question here. Within this wonderful project, do you have volunteers helping to make this come together?
Absolutely. It is a team effort. So our volunteer department, but even also our activation department, spiritual life, because through our volunteer department, we're able to get, translation. We're able to have that engagement happening from that perspective, but also getting the stories. What else did we miss? Like, especially as we get towards trying to get more residents to tell their stories. Always a raw for everyone.
It's wonderful.
Mm.
I have another question that I'm going to ask to everybody here, but Jessica, if you could just summarize the answer to it for your organization again would be amazing. How might integrating storytelling, like Senior Flicks, help strengthen your connection with residents and families in your day-to-day work? Opening that up to everybody who's here. If you want to use the chat to answer how integrating storytelling would help strengthen and connect with residents and families in your day-to-day work. And Jessica, if you can summarize again, I know you did in the presentation so well, but it'd be lovely to hear it once more.
Well, for us, it was really having a voice and enhancing, raising their voice up, and having them direct their care. We know that sometimes with providing care, it can be more like a routine, right? But knowing the person's story, who's the person behind that door, right? It really, you'll see a change, uh, most specifically from our frontline staff who are interacting with that resident on a day-to-day basis. So it was very impactful in that way. And also the the feedback from the residents saying, "Oh, someone asked me about this, and they said they watched it during the flick." So that it's really nice.
It is very nice.
Yeah.
It's amazing. Um, and I know it takes so much work to bring this together, but really storytelling is something of history of that we've always done through life. And I think that this really gives us a reminder of how important it is to let others be heard and to listen to stories, and we can learn things from that and have a real understanding of our residents. And I have another question. You mentioned that the funding ended. Tell
Mm-hmm.
us about the grant or funding that you were able to start with. And yes,
So the
Kathy, yes. Sorry, I was just going to comment. Yes, Kathy, you're right. Heard and seen. The residents have been heard
yes.
and seen. Thank you, Kathy. Yes, so the funding. We'd like to hear more about that. Sorry, Jessica, to interrupt you.
So the funding, our pastor was supposed to be here, who's the lead for spiritual life. I think he can speak more about that funding. I know it ran out, and hence we were not able to keep telling these stories. But we do want more funding. I don't remember what it is, but this funding really helped bring this project to fruition, because again, you need a different kind of infrastructure to be able to pull this off. But it is impactful. It's seniors telling, basically interviewing other seniors. But for us, from a BPSO BPG perspective, we looked at it. How are we now going to use this information to be able to directly now affect or help enhance and reinforce that person-directed care?
That's right.
So sorry
Yes,
I didn't answer your
amazing.
question.
No, no. Well, I think you did give a bit of history on how that started and then where you're moving to, which is wonderful. Before we move on, do we have any other questions? Thank you for your participation. The questions have been great. And all your wonderful comments. Um, it's been a wonderful presentation. And okay, and we have a comment here. Amazing that you were able to use the stories to enhance care, especially with staffing problems. That's interesting. I noticed through your presentation, you emphasize not only is this great for the residents, but very impactful for the staff. And then had your member there that has been a PSW for 15 years in your home, and how impactful it was, as she stated. So I agree. Very impactful for everybody involved. How many years has this been going on, Jessica?
So it started just during COVID. So 2022, and I think it ended about a year ago.
Yeah, okay, okay.
Mm.
Interesting time to start such a project, but a very important time for people. Any time, every day is important. People must feel heard and seen. But during that COVID, I know that that would have been even more challenging and such a great project for the residents to be
And
part of.
And Julian, that was
Mhm.
just for the part of the filming, the
I
actual
see.
senior flicks, but storytelling moves on. Not with
Ah, thank you.
we would love for if we had that funding to be able to keep
Yeah.
enhancing it, but because we saw the impact it had both for residents and staff, we really thought it's something we can keep going. So like, for example, this summer we're leveraging summer students, see if we can try to bring these stories out again and have that opportunity for our staff to hear, yes, we still do it through other ways, but we found this is another way to enhance
Wow.
person-directed care.
Well, I'm so happy to hear that it hasn't come to an end. It's amazing then that you're looking at other ways, and I know those students will be very, just delighted to be hearing stories, from the residents. So that's wonderful. And Carrie says, has this impacted patients with cognitive challenges, such as dementia? Were they able to share their stories in some capacity? And was that beneficial to the patients and families? That's a great question, Carrie. Thank you. So, what's your answer to that, Jessica?
Like I said, if you're able to, it'd be great to go to the YouTube channel. We do have representation of all residents with different cognitive or other physical challenges, and we try. And I think the team was so good. The spiritual life team was very good at removing those barriers, right? And try to get their story across. And I think that's impactful in itself.
Absolutely. Absolutely. Thank you. Wow. What a wonderful presentation. And we're really, really thankful for our discussion today. And Jessica and Julia for you being here to share with us this work. I would like to thank everyone that joined today for taking time out during maybe your lunch hour. Um, for those of you who are participating in this live webinar, you will soon receive a link to an online survey to evaluate today's presentation. After you have done this evaluation, you will receive your certificate of attendance. In addition, please let us know of any suggested topics you would like us to work on. Please know this work is funded by the Government of Ontario. Again, thank you so much for joining us today, and we hope you have a great rest of your day. Thank you so much, Jessica, for everything, for